Hello, everybody, and welcome to the Medicare School Daily Show. We are here to take your calls live and answer any questions you have on Medicare and Social Security. And if you can't see by the logos behind us, this show is brought to you by MedicareSchool.com. And I'm Erica Smiley. I'm one of the educators here, and I'm with Mr. Marvin Music, who's one of the owners and founders of this company. And if you're just joining us for the first time, we're here at a new time. So we decided to go top of the hour. So we're going to be here every Monday through Thursday at 11 Central until noon Central. So if you're listening and you want to call in and get your questions answered, give us a call, anything and all things Medicare. And if you're not familiar with our company, this is where we come from. It's a place of education where we want to make sure you're educated on all your different Medicare options. We take the confusion and the stress out of Medicare, and we can help you know how to enroll, when to enroll, and how to select and enroll in your plans. So, all right, we're going to get to your calls today, but first, let's go to Marvin and do a quick Medicare teaching this morning.
All righty. Well, good morning and good to be with you all. We're going to talk today about, briefly, just about Part D plans. Part D plans are for our coverage for the medications that we take on our own, just self-administered medications, things you're picking up at the pharmacy or maybe using through mail order. Original Medicare covers other meds, but only those meds that are professionally administered, either in a hospital or an outpatient setting. But for those we take on our own, we have to have Part D plans. And I just want to emphasize a couple things about their importance, especially to those of you that don't take any medications. I'm on Medicare. I also don't take medications, but I definitely enrolled into a Part D plan. And the reason for that is because we just can't look in the mirror and say, well, I'm healthy today. I don't take any meds. I'm not going to get a plan. Well, that could change in 3 hours. That could change in 3 months or any period of time. So we never want to take the chance of not having a Part D plan when we first go on Medicare. Now, if you're still working, you don't have to have a Part D plan. But if you're on Medicare fully, A and B, then it's time to get a drug plan. And so when we set a drug plan up, what we know we're going to do is we're just simply going to look at the medication we're taking today. Don't worry about 3 years or 5 years down the road, because drug plans are only written for one calendar year. And so we just look at the drugs we're taking today, get good coverage on those. And if you're not taking any, as I said, I'm not, then what I would do is just simply select the lowest cost drug plan that would be in your area. My drug plan costs me $9.60 a month. But I have it for this reason. In case something were to change in my health and I needed to have an expensive medication, it's more than likely that expensive med will be in the formulary. And as long as it is, then Medicare has a cap on all Part D plans. That cap last year in 2025 was $2,000 for the whole year, bumped up 5% this year. And this year the cap is $2,100, which means that that's the most money I would ever spend out of pocket, regardless of the cost of my medications. My cost would never exceed $2,100 as long as that medication is in the formulary, meaning it's covered by the plan. And so that's the beauty of Part D plans today. We have people that are on medications that cost $5,000 to $7,000 a month. I have a couple clients right now that are on meds that cost over $30,000 a month. They will not spend that because they will hit the cap of $2,100, and then on out, there's no cost at all to the medications. Medicare is going to pay some of that. The manufacturer is going to discount, and that Part D plan that you picked out is also responsible for the cost, but you are not. So that's why we get a plan. We'll have people say, well, I can get my plan, my meds cheaper through a GoodRx coupon or through a single care coupon or through Cost Plus Drug Company. And that's true, and that's fine. You don't have to run your meds through a plan. If you can get a coupon and get a cash price better, that's certainly fine. But that's typically just the story with generic meds. But when it comes to brand names, those discounts are not very heavy at all. So that's why we really want a drug plan to make sure expensive meds are going to be covered. So we want to start one when we first go on Medicare. Now, the exception to that would be anyone that is getting their meds to the VA, or you're on TRICARE, meaning you're retired military or you're retired civil service, and you have what's called Federal Health Employee Benefits, FEHB. All those plans, VA, TRICARE, FEHB, are considered to be credible coverage, and you do not have to have a Part D plan. But anyone else beyond that that's no longer working, that's on Medicare, you need to have that Part D plan for that protection. So we want to start the plan when we first go on Medicare. Now, we talked about those that sometimes are tempted not to get a plan. The biggest risk, of course, is to need an expensive med and not have a plan. But another risk is that when we don't take a plan, when we first are eligible, once we're on A and B, then they will charge us penalties. And those penalties are 1% of the national average drug plan, which this year, just to kind of keep it simple, is about 40-cent penalty per month. And that is for life. So if I went without a drug plan for 12 months, that would be 12 months times 40 cents. That's $4.80 penalty per month for life. So just look at it this way. Every year you go without a drug plan, you're going to have about a $5 a month penalty for the rest of your life. So we go without 2 years, they're going to add $10, and 3 years, $15. And so that's not a tremendous amount of money. It's going to add up since it is a lifetime penalty. So the risk of not having a drug plan is if you need an expensive medication, you just can't add a drug plan when you want to. We only have one time of the year we can add a drug plan. That's October 15th through December 7th. And when we make a drug switch or add a plan at that time, that new plan won't kick in until January 1. And so if someone's in a position right now, no drug plan, and they get diagnosed with something very serious, there's nothing they can do. They're going to have to wait till later this year to enroll into a drug plan that will go into effect January 1. And it's just silly to put a person in that kind of a risk. So you always want to be on a drug plan when you go on Medicare. The penalties are minimal. The risk is to need an expensive med and not have a plan, since you can't add one just whenever you would like to. Okay, so if you have other questions about that, happy to field those as we take questions today about anything Medicare and anything Social Security. So Eric and I are ready for questions.
Yeah, that's great advice, Marvin. You know, it's hard to pay for insurance when you're healthy and you don't need it, right? But when we're sick or you're having expensive medication, it's going to be one of the most important things you can have. So,
absolutely.
All right. Well, we're going to take your calls today. So if you want to give us a call and have your questions answered, you can call 833-824-2004. And again, we're here every day, 11 Central to noon Central Standard Time. So let's go to the phones and see if we have our first caller with us. Hello and welcome to Medicare School Daily Live. Who do we have on the line with us?
Hi, this is Cheryl.
Hi, Cheryl. How are you doing today?
I'm good, thank you.
Good. And what state are you calling us from, Cheryl?
I'm in Texas.
Texas. Okay, perfect. And what questions do you have for us today?
I'm approaching 65 this coming August, and I'm retired military, 21 years of service. I receive VA benefits, and I've been recommended by a lot of folks to take the TRICARE for Life. I'm calling about, what are my Medicare options and what are the rest of the gaps that I need to fill that are not covered.
Yeah, go ahead, Marvin. You want to take that one?
Sure, no problem. Hey, Cheryl, just to make sure I'm clear, I know your birthday's in August. August what? Okay, so I'm born in 1961. All right, sounds great. Are you taking Social Security yet, Cheryl?
No, I'm still working full time.
Still working. Okay, very good. Now, are you covered presently by a work plan, or are you using your TRICARE benefits?
Neither. I use the VA benefits.
Okay, just VA only. Okay, and if you don't mind my asking, why is it that you're not using your TRICARE benefits now?
I haven't. I never. You know what? I was overseas as a civilian, so I was actually receiving care through the active duty hospital that I was working in.
Okay.
Yeah.
All right. Okay. I was just curious because I didn't think there was any cost to you, or at least a minimal cost to have TRICARE. Anyway, so let me answer your question. So I think the VA benefit is wonderful, but I think TRICARE is much better insurance because with the VA system, you primarily have to go to VA hospitals, VA facilities. I know they'll let you go out, but they're primarily trying to get you into their facilities. With TRICARE, you can actually go anywhere you want to. And so if you are going to use your TRICARE benefits, you would need to enroll into Medicare A and B, because once you're eligible for Medicare, then TRICARE is going to move to the second payer position. So I think the issue for you is how much longer are you going to plan on working? Do you know? Have you set a date?
That's a good question. I'm trying to figure that out now. I don't have a reason to stop.
Okay.
I make decent money, and I was actually asked to be a consultant. So in another at another company. So
Okay. Would that, as a consultant, though, would that be like 1099 work, or would you be considered to be a W-2 employee?
1099.
Okay, it would be 1099, so you'd be self-employed then. Okay. All right. So there's a lot of moving parts here. So first off, let's deal with your present situation. So right now you're not 1099, are you? Or are you?
I am. 2 hours ago, I signed a contract.
Okay, and that's fine. All right. So
I'm also W-2. I took the 1099 for something that I could take into retirement.
Okay. So right now the only thing you're using is VA.
Yes.
Would that be correct? Okay, sounds good. Well, let me tell you what I would do if I were you. I would, especially since you're as far as insurance is concerned, you would be in a retirement status because you don't have employer provided plan that would have more than 20 employees on the payroll. You're self-employed basically as 1099. So if I were you, I would definitely consider enrolling into A and B. And then, of course, your B is going to cost you something. You know that right now it's $202.90 a month. Let me ask you this, Cheryl: is your income? Are you single or married?
Single.
Okay. Is your income below $109,000 a year?
It's above.
It's above. Okay. How much above?
30,000 maybe.
Okay, sounds good. Well, if you're like between 109, I don't have my chart in front of me, but I think it's like 137. So somewhere between 109 and 137 range, then you would have a surcharge for your Medicare B and D, and it's called an Irma, and it's basically about $95. So here's my point: if you do not take your Medicare A and B at 65, which would, of course, for you would be in August, and you delay that for a while and only use your VA benefits. If you ever want to get into Medicare in the future, you run the risk of being penalized. And so I'm saying, if I were you, I would enroll in A and B, and then what you can do is with the A and B system is you have two options. You can go to VA when you want, and then you can use your A and B whenever you want, because VA is not going to bill Medicare. Medicare is not going to pay anything to the VA. They're both government agencies, and so it's going to be totally separate. But if you really would like to have some kind of a civilian option, then what would happen is you have A and B, and then I really believe your TRICARE is going to be at no cost. And to me, TRICARE would be more quality because now you have, more providers that are available to you, more hospitals, more doctors than just the VA system. And so that's the first thing I'd find out for you. Do you need to enroll into TRICARE? If so, is there going to be any kind of a monthly expense to do that? I do not believe there will be. I think it's going to be no cost to you. So A and B pays first. TRICARE is going to be in the second payer position. Now, your Medicare B premium is going to be $202.90 a month plus that Irma, that surcharge I told you about, which is about $95. So let's just round it up and say that's going to cost you about $300 a month. Okay, but you're not going to be out of pocket very much at all because A and B pays first. TRICARE is going to pay second. Now, let me tell you about another option you have that many people that are in your situation are doing today. You can actually enroll into what is called a Medicare Advantage plan, and we call them MA only plans, Medicare Advantage only, which means it's a kind of a Medicare Advantage plans that only covers you for inpatient and outpatient care. It does not include prescription drug coverage, and here's why. Because you can get your drug medications, if you take any, through the VA, or you can get those through TRICARE, and both of those are considered to be credible coverage for Part D plans. So what happens on the MA only plan is this: when the Medicare Advantage company does not have to cover your meds, they take some of the money they get from the government and they actually give that back to you. They give you a credit. Now, if a person's on Social Security, that credit goes back to their Social Security check. You're not on it, and you don't have to be on it. So what they would do is they would take that credited money and they would reduce that Part B premium that you're obligated to pay. Right now, it's going to be about $300 because you're high income. So that could come down by probably $150 a month. So you could be on A and B at about $150 a month. You would have this MA only plan as your civilian option. And what TRICARE will do is it will coordinate benefits with the Medicare Advantage company. So when you would go to the doctor, you went to the hospital, you would give that provider your Medicare Advantage card and your TRICARE card. And you'd be out of pocket, probably nothing. I don't want to say nothing, but it's very little because all that would be covered at 100%. And it's going to cost you about $150 a month to be in that kind of a situation. Got to get your meds through VA or through TRICARE, but I think that's a very good option. Now, if you decide not to do that, my issue for you is this. Your birthday's in August, so September, October, November, so 9, 10, 11, 12. So if you do not start your Medicare B, 9, 10, 11, at the very latest would be in November. You could enroll into Medicare, and your benefits would start December 1. And if you don't do that, last month that you can enroll, because it's a 7-month window, if you don't enroll during the month of November, then what happens is now you can only come into Medicare A and B using what we call the general enrollment period. And that's only once a year for the first 3 months. So yes, you can come into Medicare down the road if you want, but you could be penalized for it, and it's a very restricted period of time. And so that's why I say I'd be very cautious. I'm still a little bit fuzzy on your work situation, okay? So let me clarify now. So you're saying you just signed a contract for 1099, but you still have active employment. Is that correct?
You're saying that right, yeah.
Okay.
And the active employment is W-2.
What would you say? Say that again one more time.
That's correct. And the active employment is a W-2.
Okay, that sounds good. And so when will that W-2 employment end?
I don't have an end date.
You do not. Okay. All right. Well, but you're not covered by the group plan at work at all.
I'm not.
Okay,
I never elected to do.
Okay, and that's fine. You didn't have to. Okay, so here's the point. What I just shared with you is right. So what's happening? Your enrollment period is going to start in May. So May, June, July, you can enroll into Medicare for an effective date for Medicare A and B, August 1. If you don't do it then, that's fine. You can still put it off September, October, and November. But in my opinion, you have made a mistake if you don't enroll into Medicare A and B no later than the end of November for a 12/1/2026 effective date. I think you will regret that. And so that's the longest you can put it off. I know you have VA and you like VA and you're probably healthy and all that's good, but you're going to create a problem for yourself with Medicare if you don't come in at that it's a 7-month window. So I'm telling you to put it off if you want to. I wouldn't. I'd still start in August, but you're not making a huge mistake if you wait all the way until November and then start your A and B December 1. And then I would do one of those MA only plans. Go to the VA when you want, use your MA plan when you want. It reduces our premium on our Part B. That's the way I would handle your case. Okay? I know that's a lot. Go ahead.
Oh, I'm understanding through a lot of listening to you that some of the Advantage programs are not an advantage, and that the TRICARE supplement program is. So you're also saying, keep the TRICARE supplement.
Yeah, you're going. Yeah, that's right. Yeah, look at it this way, though. Let me, Cheryl, look at TRICARE as secondary. TRICARE is really not a supplemental plan. You know, supplemental plans have letters, and they're designed by Medicare, and offered by insurance companies, of course. So I am not a huge fan of Medicare Advantage plans in most situations, but your situation is different. Why? Because you have VA in your back pocket, and you have this other option, Medicare Advantage, which would basically be at no cost, and you have TRICARE behind that. So to me, I think you'd be wasting money on a sup. I love supplemental plans, but here's another benefit by maybe trying the MA only plan. If you don't like it, you're not obligated to stay on it. You can disenroll from an MA only plan, as in your scenario with TRICARE. You can disenroll from that plan and go right back to A and B and having TRICARE as your secondary insurance. But you are going to spend some money with TRICARE in that scenario, because they do have it's a low max out of pocket, and you don't get any of the perks. There's no dental or anything like that when it comes to TRICARE. And so that's why I'm saying I think the MA only plan may make sense. Your supplemental plan, you're in Texas, they're very reasonable. You can probably get an in for maybe $90 to $100 in Texas. A G would be probably $140, $150. I just don't think in your scenario it is a good use of money. That's all. I love SUPs, okay? Anyone who knows me knows I do that. But certain scenarios, Advantage plans just make sense, and you happen to be one of them.
So it sounds like when I call Medicare, and I call early, I do everything early. I'll be
good.
saying yes to the A, enroll in the A, enroll in the B, and enroll in the MA only plan. From what I understand, also, I've been told through the DEERS program, which is the eligibility program on the military side, they automatically enroll me in TRICARE for life. So
that's what I think as well. So what I'm saying to you is this: you and by the way, Cheryl, if you want us to do this, we can do all this for you, everything, if you'd like. But if you do it on your own, you have to go to SSA.gov and have a my SSA.gov account, and then you can enroll in A and B. Now you can't do that yet, Cheryl. August is your birth date. So right around kind of towards the end of April, first part of May, that system will open up for you. It opens up for you about 100 days prior to your effective month. And so again, end of April, first part of May, you can enroll into A and B. And then what happens, and we'd love to be your broker if you want, but you can call us, and then we will set that MA only plan up for you and look at all your options, because there's several companies that have those. And again, what I really like about it, Cheryl, if you decide, I like this Medicare Advantage plan, I just want to have TRICARE second to A and B, you can always go back and do that anytime during Medicare's open enrollment season. But I think you'll like the reduced benefit, the cost, because they're going to give you some money back on your Part B premium, where TRICARE is not going to do that, but the Advantage plan would. And yet you're still, in my opinion, still going to have great insurance because it's a PPO plan. You can go where you want. Your Advantage plan pays first. TRICARE is going to pick up the majority, if not all, of your co-pays and co-insurance. So I think it's a great option. And you're not bound for life either. You can always get out of that if you don't like it.
Two things. How much do MA only plans cost? And yes, I would like for you guys to help me.
Yeah. There's no cost, Cheryl. Yeah, they're going to give you money back, remember, because they don't have to cover your meds. So they're going to give you credit back. So yeah, there's zero premium. And the reason for that is because they have copays. But for you only have to pay the copay. Advantage Plan is going to pay. The balance then goes to TRICARE, and they'll probably pick up 100% of the balance. Okay? So I think you really have the best of both worlds. Use VA when you want. Now you've got a great civilian option, and TRICARE will pay their part as well.
Daryl, I was going to add in, I pulled up the Irma chart, so I know Marvin talked about that surcharge where you may have to pay more for Part B. And you can Google this. If you look up 2026 Irma, IRMAA, stands for Income Related Monthly Adjusted Amount. Did you make, or do you make over 137, Cheryl? Because I know you said you were maybe 20, 30,000 over that.
Yeah, 2024. Remember that. They're looking at 2024.
Yeah, 2024. Do you think you were above 137?
I'd have to look back. I think I'm right on the cusp right there.
Okay, that's the big jump. So what Marvin was talking about, it's like 284 for the first jump up in Irma, but if you're above 137, it goes up to 405 a month. So what Marvin was saying, that Part B Giveback could really help you out with those MA only plans. So yeah, I would schedule a call with us. You can go to medicareschool.com, set up a call for May, and they'll help look at those MA only plans for you and find the one with the best Part B Giveback and the one that's going to be best to help out.
Yeah, another thing, Cheryl, with what she's saying, hey, Erica, with that chart, that first Irma level is about, what is that, like $82 or something?
Yep. It goes from the regular $202.90 up to $284.10. So it's about $82.
So it's $82. Yeah, okay, so that's your additional charge if you're going to be above the 109. Above the 109 between that and 137. Another good thing about her situation, Erica, is that since she's going to get her drug coverage through TRICARE or a VA, she doesn't have to pay the D Irma. It's not big anyways, but there's no D Irma, just the B Irma. So, thanks for looking that up. I think you've got some great options here, Cheryl. I really do.
Thanks for explaining this more clearly. I'll get on and make schedule a call with you guys.
Yeah, we'd be delighted to serve as your broker, and there's no cost for our services. We'll help you. Okay.
You guys are great. Thank you.
Right,
I've been going crazy.
Yeah, well, thanks for calling. Great talking to you.
Thanks so much, Cheryl.
Bye
Have a great day.
now. You're welcome.
Bye-bye. Yeah, that was a complicated one. Had a lot of different layers there of things going on, but yeah, she's got some good options and good coverage, it sounds like. So, all right, perfect. Let's go on and see if we got another caller on the line. Hello, and welcome to Medicare School Daily Live. Who do we have on the line with us?
Hi, this is John.
Hi, John. Where are you calling us from today?
I'm calling from Connecticut.
From Connecticut. All right. And what questions do you have for us?
First off, my wife and I are both members, and we want to thank Marvin so much. We signed up a couple years ago with him after another broker gave us incorrect advice about getting out of an Advantage plan into a basic without medical underwriting. So he saved us so much money, and based on Marvin's advice to get out of Advantage plan, my wife developed melanoma skin cancer, and that is saving us so much. But no, I do not work for your company. I have a Social Security question. Okay. Marvin mentioned he's able to help with that as well, if that's okay.
Yeah, go right ahead, John. We'll try.
Yes, so my wife took early Social Security benefits at 62 and a half about 5 years ago or so. I'm still working. 2 years ago was my full retirement age, and I knew my full retirement amount at that time. I'm continuing to work, making far a bigger salary. Will my full retirement age amount continue to grow as I work, because the spousal 50% is based off full retirement age? And the second question is, do I have to do anything for her to get 50% spousal benefit from my salary?
Okay. Erica, you want me to take it, or you want to take it?
Yeah, you can take that. I mean, you can continue to grow your account up to age 70, but the question's about the spousal. Yeah, what do you think about that, Marvin?
Yes, okay, very good. Yeah, so Erica's right. Let's emphasize that, John. As you continue to work, what's happening is every year they're recalculating your benefit. So what happens is they take the top 35 years, and so probably some of the years that your income now is higher than some of those previous years. So it's knocking those out. So they recalculate our benefit every year. So it's wise to keep taking. So I think that's what you're asking in the one question. The other one, when it comes to spousal, so spousal benefit is this. It is let's take your wife. So spousal would be 50% of whatever you are eligible for at your full retirement age, less a penalty if she took her own. Now, right now, she actually cannot take spousal until you apply for Social Security. In the old days, she could have, but she can't do that. So to take spousal, your spouse that you're married to had to be married for a year, all that, but they have to be taken. So until you take, she is not going to be able to get her 50%. But also, since she did take early, she took a penalty, and that penalty will continue to carry over, and she would get 50% of your full retirement age once you take, less penalty. Does that make sense, sir?
Yes. Yes, it does. Do you know if I have to apply for her spousal, or will Social Security automatically calculate it when I start taking mine and up her number?
No, she'll have to convert to it. It's very simple to do. Once you start taking, then she can call in and say, hey, my husband's taking now, I'd like to apply for spousal. But yeah, it will not be automatic at all. Anytime we change method of Social Security, then we have to initiate that.
Perfect. Thank you so much. Again, you guys saved us a lot of money getting us out of Advantage, and knowing there's no medical underwriting in Connecticut, which is not what the other broker tried to get us into. Thank you so much.
Well, John,
Bye.
Thank you for the call, sir. Thanks for letting us serve as your broker, too. We appreciate it.
Goodbye.
Goodbye.
Thanks so much. Have a good day. So yeah, just to clarify that, Marvin, so if a gentleman, let's say he continues to grow his account to age 70, his spouse can still only get 50% of the full retirement age amount, correct?
Exactly right.
Okay.
She'll get it if he dies, survivor benefits 100%, but spousal is only 50. Yeah. So
All right.
it benefits him to grow it to age 70 for his own benefit for her future as a widow if that he dies before her, but it doesn't help her for spousal living.
Yeah. All right. We haven't had a lot of Social Security questions, so we've had more Medicare, so it's good to get those. So, all right, any questions you all have for us, give us a call, 833-824-2004. Let's go on to our next caller. Hello, and welcome to Medicare School Daily Live. Who do we have on the line with us?
This is Doug.
Hi, Doug. Thanks for calling in today. Where are you calling us from?
I'm calling you from the refinery I work at.
Well, what state? What state are you in? It's good to know.
If you're asking where I'm from Houma, Louisiana.
Okay.
I'm about an hour, so I've been commuting here for 32 years.
Oh, wow. Well, we appreciate you listening and calling in today. What questions do you have for us?
Nothing real sophisticated. I was just kind of more like looking for clarification. I mean, I'm 64. I'll be 65 in September, and my plan is to continue to work. If the Lord's willing and the creeks don't rise, right? If my health holds out, my goal would be to make it to possibly 67. And who knows, maybe work that year too, and sandbag some checks, right?
Okay. So is your
my plan would be to take my Social Security at 67. That would be my plan. Now, the Medicare would be everything that I've heard, and Marvin say it, and other people, that as long as and we got 20,000 employees, so it's not like we're a little
small
bitty
employer.
20 person.
Yeah.
We're not a small company.
Yeah.
So, and I got pretty good private insurance. So with that being said, I guess I'd really have to measure up to see. It would come down to the drug coverage, I guess, and the total price head to head against my insurance.
Yeah, exactly right. Hey, Doug, what's it cost you to be on the plan, your company plan right now, out of your pocket? Premium wise.
About 187 every 2 weeks.
So
it actually went up about $71, and thanks to. Well, we won't get into name calling, but
okay.
It started around 08, 09. Let's just say that.
Okay. So every 2 weeks then. So you're paying about definitely less than $400 a month for your plan. Do you have a good plan? Meaning, is the deductible fairly low?
It's an excellent plan.
Okay.
No, it's an excellent plan.
Are you the only one covered
Blue Cross,
by Doug?
Blue Shield, Highmark. Yeah, I'm by myself.
Okay. Yeah. And
my wife actually is an RN, and she works for United Health, so she's on their plan. So,
okay.
It's ironic. The sad part about it is, speaking of private insurance, second I put her on my plan, out the roof, right?
Yeah. Mm-hmm. Yeah, I understand. Well, Doug, you're in the money. So if you like the plan, then I would encourage you just stay with it. Medicare is going to be about that same amount for you, probably a little bit less. But I think you're setting fine for sure. So sometimes it's pretty easy. We have people that are paying $600 a month. Well, that's a no-brainer. Go on Medicare. But you're just kind of right in that same position that you'd be, with Medicare. Now, you married filing a joint return. Do you married filing a joint return? Mm-hmm. Okay. Is your all's income below $218,000 a year?
We're probably right in that neck of the woods.
Okay, yeah. So my point is, you'd be looking. Let's just call it 203 on the B, a MedSup plan about 150. So now we're at 355. Got a drug plan in there, so you're paying about 380 a month. So I think you're fine. And it sounds like you like the plan. And I would tell you this: if you see some price increase, later in the year as you all going through renewal or something, that thing does go above 400, 420 range, then you may want to call us and we can maybe then make a comparison. But I think you're fine where you are. I really do. I could go either way on that. Now, if you told me you had a bad plan, you weren't happy with it, that'd be a whole nother issue. But it sounds like you like your insurance.
Well, I've been with these folks 32 years, so
yeah.
Actually 35 years. I've been here 32 years. But at the end of the day, my big reason to call was that only, not that only, was actually to ask the difference on N and G. I got a friend that's on N. He don't have a lot of doctor's appointments and stuff. So, and it's ironic. His father-in-law can't swears by G, but he pays out the nose.
Yeah. Well, I think N is an excellent option in many, many markets. Sometimes the difference between G and N is not very much, but sometimes it's $50, $60 a month, and so I think N would be a great option. Hey, Doug, I also want to ask you now: are you contributing to an HSA right now?
No.
Okay.
Never have.
And okay, probably won't then. Well, then I think if you don't do anything with Medicare, at least go ahead and enroll in Medicare A only. There's not going to be any premium for you. It gets you in the Medicare system, so you've got a Medicare number, and it just makes coming into Medicare a little bit easier down the road. And you can do that. You said your birthday is when? September?
September 12th. Yeah, that's part of what I didn't know.
Yeah.
If I got on A, does that number just kind of sitting there in the slot, waiting at whatever point I decide to say, hey, I'm all in now?
Yeah, it'll be there, but they'll send you a card. You'll have A only, and then that, of course, is just hospital and skilled nursing facility. But if you ever were hospitalized, it's very probable that Medicare could pay something. They don't pay deductibles or copays, but on the A side,
so
your group plan pays first, and they pay second, and they pay co-insurance.
All right, you answered it. So if you do jump in, then Medicare would take some of that. You'd have to always
co-insurance.
Show the secondary
Yes,
insurance.
sir. Exactly.
Right.
Yeah. So if you've got a co-insurance responsibility on your hospitalization coverage, then Medicare could pay some of that. So I would enroll in A only. It's zero premium, it's not going to hurt, and it could be sitting there for you if you ever needed it. Okay.
Makes sense.
All right, Doug.
That answer your question?
Yeah, we appreciate the call. Anything else?
Hopefully this one was pretty simple.
Okay. Yeah. Well, hey, we enjoyed talking to you. Let us know if we can help you down the road. We'd be delighted to serve you, sir. Let us know.
Okay. Thanks.
Okay.
Bye-bye.
Take care. See you. Bye.
Thanks, Doug. Take care. All right. Let's go on to our next caller. Hello, and welcome to Medicare School Daily Live. Who do we have on the line with us?
Marie.
Hi, Marie. What state are you calling us from today?
Michigan.
Michigan. All right. And what questions do you have for us?
First, I want to thank you for all your help. I have signed up with you guys for Medicare that will start in April, Plan G. I received, a letter from Social Security. My husband and I, we both turned 65 in April, and we are selling a business April 1. And so my question is, we received a letter saying that the Irma, we're going to be charged the Irma, and it's, let's see here, $202.90 is going to be added to our premium.
Right.
The question I have the SSA 44 form in front of me, and we have a work reduction because I retired January 1. He's retiring April 1. But we have this sale of a business. And so when they looked back at 24, there was portions being purchased in 24 and 25. Now this year, the remainder is going to be purchased. So I'm not quite sure what to do on the SSA because it wants me to estimate 2026's income and 2027. With the sale of the business happening on April 1.
Okay.
I'm not sure to estimate it.
Yeah, Marie, number one, you don't put down 2027, not necessary at all. So let's talk this through. So you have an Irma because of 2024, and you said you retired this year, January 1?
I did.
Okay, good. So
I'm working
part-time. So work reduction, then that's fine. So now here's my question. Yeah. So as far as 2026 is concerned, you're not going to give them 2025 because you didn't have a life-changing event then. So you're eligible to give them 2026 numbers. My question is, will 2026 be less than 2024?
Our wages, definitely.
Well, no,
But
total income. No, you're going to have to count the sale of the business as well, whatever your payments are on that. So again, everything is going to count as income, that modified adjusted gross. So do you have a feel for that number for this year?
No, I really don't. And I know what the sale of the business is. Maybe you can answer this question. We're not getting all the money up front. We're just getting a down payment.
Sure.
Do we claim the full sale of the business or only what is received?
Yeah, I think just what you're actually receiving in cash will only be. I don't think it's the total amount at all. I mean, I'm not an accountant, but I've never heard it work that way. I think it's just the income you'll actually get. So what I do is look at your husband's income, of course, what he's made, what he'll make the first, through April, anything thereafter, your part-time income, and then what the sales proceed will be. And if that's going to bring you down below, the amount, you're at that second level. Erica, you have that chart. What's the second level?
I do. For a married couple, so the first level is 218 to 274. Second level is 274 to 342.
Very good. So that's where you all are, 274 to 342. So if you come below the 274 for this year, 2026, then I would appeal to Irma. Even if you don't go all the way down, the lowest level, of course, is 218. But you can reduce that if you stay between that 218 to 274. Do you have any idea whatsoever, Marie?
I actually don't. I have an email into our CPA to find out about depreciation and capital gains on it, all of that, and I haven't received an answer.
Right. Okay. Yeah. And it will be. It'll just be, the capital gains, which is, 20%. So that should count as income as far as the taxes are concerned. So yeah, your accountant will tell you. And it's worth the time, even if you don't go all the way down and eliminate the Irma, you can at least eliminate some of it if you fall below that 274. Okay. So here's what you're going to do. You're going to put work reduction. You can use your date. You can use your husband's date. Either one. It doesn't matter. And tell me again, your Medicare starts April 1?
It does.
Okay, good. So then I would use your date for both of you. Just since yours already happened January 1, because it doesn't have to be both. Since you file a joint return, the January 1 date for you will be just fine on both appeals, his and yours.
Okay.
Okay.
Oh, so I have to fill out two of them, one for him and one for I.
Exactly right. Yeah, you have the individual Social Security numbers on there, but you get to use the same number since you file a joint return and the same life-changing event and date.
Okay. All right. The same. Okay. Mm-hmm.
Yeah, because
I understand.
Oh, I was going to say what Marvin's saying. Yeah, if you fill that out for both of you, you could go down a level with that work reduction from $405, each of you having to pay $405.80 a month, down to $284.10 a month. Nice. So it could make a big difference. Yeah.
Yeah. Plus the Irma, So it's definitely worth your time. Hopefully you get to go all the way below it, but if not, just give them those new numbers.
I don't have to put in estimated for 2027.
No, I wouldn't do that at all. I know that form looks like you have to or whatever, but listen, even if you did put the 2027 numbers in, I promise you, next year, later this year, when they calculate IRMAs for 2027, they're not going to go back and look at that form. They're just not. You're going to get another IRMA letter. So I would just put in, I'd leave the last one blank and just fill that middle one in and put 2026. It'll be sufficient. And remember that goes to the local office. They'll be the one that you get that to. And if you fax it, also mail a hard copy. Dropping it off is our preference, but sometimes people can't do that. Yeah, don't fax alone. You fax, you mail, and we encourage people when you mail it in, do put a note on there, a little sticky note. Hey, I fax this in, whatever date. Just sending a hard copy to make sure you all receive this. Yeah.
Okay.
They lose the faxes sometimes.
Do they? I can see that.
Yeah.
In 2027, so if we fall below the IRMA, they'll automatically make an adjustment. We don't have to fill out another SSA.
Yeah, well, here's what's going to happen. Remember what's going to happen, though. 2027, next year, they're going to look at 2025. So it sounds like your income is up as well. So what you'll do then is you can still use a life-changing event, yours or his, and then give them the new numbers then for 2027.
Oh,
Yeah, that's the way it
Okay.
works because they're always looking back too, and the appeal gives you the right to say,
Yeah.
hey, don't look back too. I had a life-changing event. So you can use the same event for 2 appeals.
Okay.
Okay.
Perfect.
All right.
Let's see. And if I put an estimate in for 2026 and I'm off, I would never want them to think I'm lying.
Yeah, well,
Um,
and I understand that. I think it's good to be sensitive. So if something were to drastically change where it would put you in a different Irma, then you just call your local office and say, hey, I thought I was accurate. It's not going to come in that way. And they'll tell you how to make that correction. Okay?
Oh,
Hey,
okay.
yeah.
Okay.
And let me tell you another thing you all can do, and I've had plenty of people do this, because you're just semi-retiring. Then what can happen, and again, if your income is affected, you actually then can do another appeal when you fully retire. Yeah, so
Oh.
yeah, you can. You can work reduction, and then once you're fully done, and meaning if it makes sense to do it mathematically, but
Sure.
you can do it. 2 years for work reduction, 2 years for work stoppage.
Okay. All right. I'm making notes as we talk. Okay.
All right.
It is
Well,
so much.
okay,
Thank
Marie, you
you
good?
so much. Yeah, I'm good. And one other detail, we are not collecting Social Security yet at this time. I don't know if that makes any difference at all.
No. No. I
No,
mean, it's
okay.
just going to count as income, down the road. But right now, no big deal.
Okay, super. Thank you, Erica. Then appreciate
Yeah.
it very much.
Yeah, thank
Yeah.
you, and good luck with that form. I hope you get it knocked down a notch or two for you.
Nice talking to you,
Well,
Marie.
thank you. Well,
Yeah.
nice to talk to you too.
Yeah.
Bye-bye.
You too. Bye-bye. Take care.
Bye-bye. You too. Bye-bye.
Yeah, it's interesting. A lot of people, they may have to fill out that SSA 44 and appeal that for a couple years, first 2 or 3 years after they retire. So, all right, good deal. If you guys want to call in and have your questions answered, call 833-824-2004. And let's go to the lines for our next caller. Hello and welcome to Medicare School Daily Live. Who do we have on the line with us?
Hi, this is Larry.
Hi, Larry. Where are you calling us from today?
The great state of Ohio.
All right. And then what questions do you have for us?
Okay, so I'm getting information now, and well, first I'd like to say that I've subscribed to your YouTube channel and watching your videos, and they've been
Well,
very
thank you.
helpful. I have a question regarding the Medicare enrollment process. So I'll be turning 62 today.
Okay.
Not today, sorry, this year. And I have about another 5 years to go to full retirement, 67. So what question I had was on the Medicare enrollment process. Now, I know I watched your video on this before, but I need to enroll in Medicare when I'm 65. Is that correct?
Well, so that depends. Are you still working, Larry, or are you retired?
Yes. I am. No, I'm going to work full time until my full retirement age. So
Okay,
I'm still
so
full time.
Okay, so you're going to work until 67?
67, right?
Okay. Yeah. Now, are you with a large employer? So do you guys have more than 20 people on the payroll there where you are?
Oh yes, a large employer, yes.
Okay. And are you happy with your group plan that you're on at work?
Yeah, it's through Aetna, and they've been pretty good. They've covered pretty much most of my expenses with the copays and stuff. But yeah, it's been a good plan.
Okay.
I was just wondering, when I hit, I think it was age 65, that I must enroll in Medicare,
Yeah.
and
So
then I
that's
could
it.
keep my employer plan for
Yeah.
as a supplementary plan. Yeah. Okay.
Well, so yeah, that's a common misconception. So a lot of people think that they have to enroll in Medicare when they're 65. But let me ask, what do you pay? Do you know what you pay per month for your insurance plan that you're on now?
Somewhere around 220, something around 220, 230 a month.
Okay, so that's not per paycheck, that's per month.
I'd have to look it up. I don't recall offhand.
Okay, I only
It might be
asked
per paycheck.
Okay, yeah. I only ask because you have some options. So if you're going to continue to work to age 67, you do not have to enroll in Medicare when you're 65. Now, let
Okay.
me ask you, when are you're going to not take Social Security until your full retirement age, correct?
Right. I'm not going to go on Social Security. I've
Okay.
already decided I'm going to stay until my
Okay.
full retirement age.
Okay, so yeah, you're right. You do your first chance to enroll in Medicare is when you turn 65, and that's called your initial enrollment period. But if you want to keep working and you're on an employer plan that's with a large company like yours and you're happy with it, you can stay on that plan and continue to work. And then when you are ready to retire, you'll get something called an SEP. So, Larry, that's a special enrollment period. And as long as you don't have any gaps in your coverage back to age 65, you won't have any penalties or any concerns. You can work to your 67, 68, 70, as long as you want to work. And then that's going to give you another window to come into Medicare and enroll in Medicare. Does that make sense?
Yes, it does.
Yeah.
Okay.
Now,
That was the confusion I had because I wasn't sure if I needed to enroll
yeah.
at
Now let me ask:
65.
Are you contributing to an HSA at work, a health savings account?
No, I have an FSA, but not an HSA.
Okay, so since you only have the FSA, if you wanted to, when you turn 65, what's your birthday? When are you going to turn 65?
September.
Okay, September. So if you wanted to, as early as, let's see, June of that year, as early as June, you could actually enroll in Part A only. So Part A only is kind of your inpatient, your hospital coverage, and it's actually $0. So as long as you've worked for 40 quarters or 10 years, it's $0 to have Part A. So you could still stay on your employer plan, but you could set up Part A, and then that might pay second to your employer plan. So let's say you were hospitalized. It's not going to pay deductibles or copays or anything like that, but Part A may pay coinsurance, and it may add a little extra help on top of your employer plan. So you could enroll in Part A, and then you've got your Social Security number already set up, and it makes it a little bit easier to come into Medicare Part B when you are ready to retire.
Okay, so I can do Part A on my
Yep.
when I turn 65, but June before I turn 65.
Well, you could do it as early as June. Yep. So it would start on September 1st, but you could enroll as early
Right.
as June. You could do it in July or August, and it would start September 1st on your birthday. Yeah, but you could enroll in A only. And then if you have do you have a SSA.gov account set up yet, Larry?
Yeah, I've already got all that set up. Yep.
Okay. Yeah. So you just go on there and say, I want to enroll in A only. That's kind of the easiest way to do it. And then when you're ready, they're going to send you a red, white, and blue Medicare card, but it'll say Part A start date only. You have your Medicare number. And then when you're ready to retire, we'd be happy to work with you. You can call us. We can help you with all that SEP paperwork. There is a little bit of extra paperwork when you come in through an SEP when you're ready to retire. But yeah, I'd say the biggest thing is, enroll in Part A when you turn 65, and then just make sure you don't have any gaps in coverage. If you're going to keep working, you just want to make sure you don't have any gaps and you're going to stay with that employer. And then you can come into Medicare when you're ready to retire.
Okay, so if I get the Part A when I'm 65, that will become secondary to my primary insurance at my work?
Yeah. That's inpatient and hospital. So yeah, if you are hospitalized, that might pick up and pay some coinsurance in addition to your employer plan. But your employer plan would still pay first.
Yeah. Anytime there's 20 or more employees on the payroll, Larry, then employer is first, and Medicare will pay second. So they determine that. So
yeah, but if you're good to go.
At my work, I also subscribe to a supplemental insurance through AFLAC that covers some hospitalizations and stuff too.
Good.
Okay.
Would that be something I should keep or drop, you think?
What would you say, Marvin, on that?
Yeah, I would keep that because AFLAC plans are indemnity plans. They're not going to pay any claims. They're going to give you money if you had any kind of an injury or an accident or some kind of an illness. So no, I think those are fine plans. So I wouldn't. Now, as you get ready to retire, you may want to reconsider that, of course, because that's tied to employer options. But for now, I'd keep it for sure.
Okay.
Does that answer your questions, Larry?
Yeah, that answers my questions for now, and I will definitely keep watching your channel there and getting more information as I go along here. I'm trying to collect all the information I can before I retire, so I'm
Well,
not behind the eight ball.
yeah.
So to
Well,
say.
you're preparing well, so we hope the channel will continue to help you, and when it's time, we'll be ready for you. Okay, but we appreciate your call today, Larry.
All right. Thanks, Larry.
Thank you very much, guys.
Take care.
Uh-huh.
Okay,
Bye-bye.
Thank you. Bye bye.
All right. I think we got another caller on the line. Let's go and see who we have waiting on us. Hello and welcome to Medicare School Daily Live. Who do we have on the line with us? Hello? Well, we might have lost him. Hello? Don't think we have anybody there. Yep. Hello and welcome to Medicare School Daily. Who do we have on the line with us?
Oh, I'm so excited. Monica Hinton is my name.
Well, hi, Monica. We're excited too. Where are you calling us from today?
Virginia.
Virginia. All right, perfect. And what questions do you have for us?
Okay, good. I when I was waiting for the call, the gal told me that this would be aired tomorrow and not today, so don't worry about the kickback from Marvin answering my call in my own voice. Or because I'm looking at the screen and on the phone as well, but she told me it's for another day. Okay, so I currently have I had a traditional SUP when I first started. Right now I'm 70 years old, but I don't have any medications. I don't have any medical diagnoses. So I bought a stroke and cancer rider, and I switched over to an Advantage Care. And I'll tell you just before, reason why I switched over to the Advantage Care is because on the regular supplement for the dental, I couldn't get anything. They took my money, didn't, the tier of care that I needed, they wouldn't appropriate for another year. So meanwhile, I'm giving them the premium. I'm not getting any care for my teeth. So I switched over when I could to the Advantage Care, and I bought the riders. So here's my problem. The Advantage Care, the dental, clearly showed it that I need a particular type of care, and they denied it. Mm-hmm. So my dentist said, well, we submitted all the information that we were supposed to submit. You need to, and I guess that's what you call an appeal. I don't know how to advocate for myself.
Okay.
I
yeah. Hey, Monica.
I don't know what I'm saying.
Yeah, let me ask you
sir.
this real quickly. So, when you looked at your dental benefits on the Advantage plan, did it say that it would cover preventive as well as comprehensive?
Yes, sir, and they cover a great deal of the comprehensive already.
Okay, that's good. So, are you? Have they told you why they're now denying that claim? Was there a reason?
Yeah, they said because I didn't need it.
Oh, okay. So, but the dentist said you.
Yeah, the dentist said there's a big hole in your mouth, in your tooth. Uh-huh. I want to cover it with a crown.
Sure.
What is there not to see? But I don't know how to technically speak to these people.
Okay, yeah, you're right. That would be an appeal. If you don't mind, who's the carrier? What advanced plan are we talking about?
Humana Total Care.
Okay, yeah.
And they're great. They give me a $3,000 benefit.
Yeah, no, that sounds good. Well, I definitely would appeal that for sure. Now, I will tell you, I think about 70% of all appeals are won. So it's well worth your time to do that. And you may have to have the doctor involved with some kind of records, but I would call Humana and tell them that you want to appeal. What is the process to do so? And if you need some help, are you our client?
Yes, I am.
Okay, good. Okay, good. Well, we're glad you are, Monica. Our customer service team should be able to at least give you some direction with that as well. I mean, we'll do all we can to get involved and try to help you. You'll have to, of course, do the paperwork, but I'm going to make sure it gets to the right person, that you know the right process. That'll be involved to win that.
Okay.
It's definitely worth your time. Truly, most appeals are won. Can't promise it, but it's worth your time. Go ahead.
I'm sorry.
Yeah, right.
I've got another question.
Yeah, go right ahead.
Okay. So because I know I'm playing Russian roulette, I know that, being on the Advantage Care, but I also know I have until March 31st to change over horizontally to another Advantage Care if I choose to. My question here is that I'm looking at the Giveback because I have no medications and diagnoses. I'm almost finished. I'm almost at my max with Humana Total Care, and I'm looking to go to the Giveback. My question is on the Giveback, where does the money go? Does it go directly into the payment for my Part B, or does it go to me? Okay. If you know.
Oh yeah, we know. Yeah. So what happens if you're on Social Security? Then the Giveback goes as a credit to your Social Security check, and you all obviously are your 70. So I'm assuming you're taking Social Security. So what you would see, whatever amount the Giveback is, it was $120 a month. How much is it?
I can't remember what my person said.
Yeah, whatever it is. But I guess I'm hearing you say you're not on a Giveback now. You're considering re-enrolling in another Advantage with the Giveback. Okay, good. So whatever that amount is, $120, $130 a month, then that will go back to your check. Now, what will happen? It takes them about 60 to 90 days to process that. So that means that you will probably get kind of more of a lump sum, 2 or 3 months down the road. It's not a fast process, but you will get that money. So if you make that plan effective March 1, if it's 120, then you may not see that 120, on the definitely not the March check or April check may come in May, but you will get it for sure.
Okay, I have one last question.
Yep, go right ahead.
I intend to go back before. I know I can't do it right now, but I intend to go back to the supplemental plans. My concern is the reason why I jumped ship on them, besides the fact that thank God I don't have any health issues, but I just like you told someone yesterday, she never had any health issues, and all of a sudden she had cancer. Yeah. That's the woman with the Kaiser issue. Ooh. Yeah. But anyway, so I am concerned that once I go back to a G or an N, and I had G originally, then I switched to an N the following year, and then I switched to the SUP because I couldn't get any dental care from the G or N has nothing to do with it, but I couldn't buy enough dental care. My concern is, it's going to be the same thing. Even when I only paid $99 for my G plan. That's just to tell you what good health I'm in. It's 70 in Virginia. But I'm still concerned about my dental. I'm still concerned about that. So do you have any suggestions?
Yes.
Because I'm going to go back before the end of the year. I'm going back.
Okay.
By January 1st, I will go back to total.
Okay, that sounds good. Well, when you decide to make that move, let us know. We'll help, of course, facilitate it. But then we actually sell right now 3 different dental options, companies. And so each of those are a little bit different. And we'd like to, of course, find out if there's one of them that your dentist would be in the network. If not, they're PPOs anyway, so you can really go wherever you want. So I would tell you that our agent will take the time to go through those different plans, give you the premiums, give you the annual benefits. And they're all really good. It's just different. Like one plan covers implants better than the others. Another plan is basic, like $1,500 worth of services, but it has a very low premium. So depending upon your situation at that time, we'll show you those options. Okay? We will.
Well, the good news is knowing that I have a 70% chance of winning this appeal is very good, but I just got to happen before April 1st because I'm out of here.
Yeah. Okay.
And the better news is that I have so much of my dental taken care of from the Humana Total Choice dental piece, the $3,000 benefit, that by the time I get to another dental plan, I won't need nearly as much work because I'm all done now.
That's good.
Yeah.
All right.
I thank you so much.
You're welcome so much. Thanks for letting us serve as your broker, and let us know when you're ready to make the next move, okay?
Oh, I only got a call from you guys this morning. You guys are all over it. You're all over it, and I'm so grateful for that.
Glad to hear it. Okay, take care.
Thanks for all your calls today. It was great talking to everybody. And remember, if you want to be on the show, we're going to be here every Monday through Thursday, 11 Central Standard Time to noon Central Standard Time. And the number to call in is going to be 833-824-2004. So join us next time, and we'll talk to you soon. Stay healthy. Take care. Bye-bye.
Take care. Thank you.